In this video, I'm going to be breaking down graft selection and specifically the patella tendon. In this video, I'm going to be breaking down graft selection and specifically the patella tendon, which is arguably the most commonly seen graft that we typically see in the rehab setting. I'm using some from my experiences, giving my opinion, also using research and specifically an article from the Journal of American Academy of Orthopedic Surgeons, and the article is titled "Graft Selection in Contemporary Graft Selection in Contemporary Anterior Cruciate Ligament Reconstruction," which is by Barbara Raphael et al. And I'll put the link below. So I just wanted to kind of go over graft selection, why it's important, and ultimately what I want you guys to understand is that it should be 100% individualized. There are a lot of factors that goes into play. You're obviously looking at the patient's age, gender may make a difference, also their sport or even their profession. These are all sort of the major factors that we want to take into consideration. So I am going to be reading a little bit off of the screen, so just bear with me as I kind of go through the 4 major points, which is going to be the indications, complications, pros, and the cons. So again, starting with the patella tendon grafts, the indications as far as like who may be more likely to select this graft are going to be mostly young, athletic population. You also want to make sure that typically are going to be skeletally mature, just because it is taking from a graft size from a growth plate, which is why you see typically 13, 14-year-olds are typically selecting from a quad tendon or maybe even a hamstring graft. So yeah, you're looking for a younger athletic population, and you're looking for, again, more skeletally mature patients. Those are usually the 2 bigger indications. Also, I would say a profession or sport that doesn't require a lot of kneeling. So for example, maybe a volleyball player because they have to dive a lot, or maybe a goalkeeper in soccer, as far as sports goes. And in a more professional setting, you may look for a plumber or a mechanic who have to be on their knees a lot. Those are the indications that you may want to shy away from the patella tendon and move towards some of the other ones. Again, there's no perfect graft, which is what I want all of you guys to understand and how I typically will explain it to patients, just trying to make the best educated decision. As far as complication goes, and this is directly from the study itself, you have patella fracture, which is about a 0 to 2% indication rate. I personally have actually never seen one, outside of, I guess, potentially one time one of my girls fell directly on her knee. Kind of hard to say if it was directly from what's her patella weakened because of the surgery, but she was close to she was over a year out at that point in time. So again, it's hard to say, but it's not something that I've seen very often. Patella tendon rupture, which is actually only 0.25% as found in this study. I have actually never seen one of these. Patella tendinopathy, this is, I would say, the most common one. They don't give a percentage in this study, but this is very common, and they sort of pair patella tendinopathy with anterior knee pain. They sort of go hand in hand, obviously just depending on the location of the pain. But for anterior knee pain, they listed it at a 17.4% complication rate. That is something that we really need to take consideration throughout the rehab process, and making sure they were gradually dosing especially quad loading activities, and also positive shin angle or knee over toes loading, because that's going to be the most aggressive load for the knee and the front of the knee specifically, which again can potentially aggravate the knee. So making sure that we understand how to gradually expose that knee to a positive shin angle load, and also depth of load and weight of load, is going to be something that we really need to be paying attention to throughout the recovery process. And also making sure the patient understands, like, hey, I don't want you feeling pain in the front of your knee. And if you do and it's minor, okay, maybe you're willing to push through that a little bit, but 100% it should not linger into the next day, or it shouldn't be something that's lingering, especially into the following session. So those are sort of the 4 major complications that are seen after a patella tendon graft. So some of the pros, okay, so it's reliable, it's time tested. You know, again, it's it is the most researched graft out there, and to this day still considered the gold standard. It's the fastest incorporation and healing. It's improved rates of return to sport compared to the hamstring graft, just looking at re-tear rates. And in this study, what they have found that there is a lower re-rupture rate compared to hamstrings. Their range is 2 to 6.6% for patella tendon grafts and 4.9 to 17.5% for hamstring grafts. Again, that is just based on this study and their data they collected. Some of the cons: you have a higher chance of anterior knee pain. That was already explained in the complications. Pain with kneeling, that is why we had discussed possibly specific sports or positions or professions that require you to kneel a lot. You maybe want to shy away from the patella tendon graft. It's also contraindicated for the skeletal immature, again, because the patella tendon is attached to a growth plate. You want to make sure that they shouldn't be choosing the patella tendon graft. And then lastly, according to this study, there's an increased rate of osteoarthritis compared to hamstring grafts. They listed as a 39% compared to 18% at 10 years post-op. So again, according to this study, it is a pretty big difference, double compared to a hamstring graft. So again, just wanted to kind of break down the pros and the cons, indications, and also some of the complications that can be seen after a patella tendon graft. So hopefully you guys found this video helpful, and you can kind of look at the other ones for the other grafts. Thank you for watching today's video. Please feel free to like and subscribe. I have started an ACL Mastermind group, which is a program designed for physical therapists, physios, strength coaches, students, and athletic trainers who want to learn more about ACL rehab. It currently holds over 600 videos and has over 500 members, with new videos added every single month. The videos cover immediate post-op to late-stage sports-specific movements and everything in between. Content specifically also includes rehab complications, treatment philosophies, case studies where you can see my real-life patients, movement assessments, exercise breakdowns so you understand how to properly teach the exercises. The exercises are also arranged by difficulty level for strengthening exercises, plyometrics, balance, and neuromuscular control. Of course, it also covers late stage for movement exercises from structured all the way to randomized and chaotic to mimic more sports-related settings. And lastly, you also learn how to do return to sport testing, which is extremely important, and this what ultimately determines whether or not someone is safe or not safe to return to sports again. There's also questions within the group where you can learn how I engage with patients and their parents of how to answer difficult questions throughout the rehab process, which is inevitable to come up. And lastly, you gain access to a private forum where you can ask questions directly to me and others within the community. We share research articles, we share other equipment and beneficial equipment and things like that. Anything that can come up within the ACL rehab spectrum, that's when you can ask within the private forum. And lastly, you can also download the app where you can gain access in your respective facilities directly on your phones. If you have any interest, please feel free to click the link below, and I appreciate you watching today's video.